Hello everyone. So now we will be discussing about PID. Okay. So please all of you who are watching, please subscribe my channel. There is a lot of reporting on this YouTube studio that you all are watching, but you're not subscribing. Please subscribe it. It means a lot to me, and really it will help me a lot in my teaching journey. Okay. So let's start it. So here we'll be discussing the PID or cervicitis. You can say the same organisms which affect the cervix. They cause PID. The most common organism which help is chlamydia, and the chlamydial PID or chlamydial cervicitis is asymptomatic, and that is why it get spreads a lot, and it's the most common PID to cause infertility. Infertility is the last sequel of the PID due to the tubal blockage. Okay, so chlamydia, the drug of choice for chlamydial infection is doxycycline, and the drug of choice for the though all the another drug for the chlamydia is azithromycin. Okay, the another organism which causes cervicitis or PID is the gonorrhea. You all know that, Neisseria gonorrhoeae, and it causes symptomatic. So if your question come most common symptomatic PID, you have to mark it gonorrhea. Okay, the third organism which can also cause PID is bacterial vaginosis or Gardnerella vaginalis. The drug of choice for gonorrhea is ceftriaxone. The triad which a patient of PID will come with which the patient will present to us will be lower abdominal pain, adnexal tenderness, and cervical motion tenderness, because as the in PID, the cervix is involved, endometrial cavity is involved, fallopian tube is involved. So that is why there is adnexal tenderness and cervical motion tenderness. The two clinical problems in which there is cervical motion tenderness is ectopic pregnancy or the adnexal tenderness. So you have to remember, whenever in the question there is given cervical motion tenderness, it can be two case. Either it can be from PID or it can be ectopic pregnancy. Okay, in ectopic pregnancy, it is due to the ruptured ectopic pregnancy. The blood leaks from the blood leaks from the so there is a rupture, and there is lot of peritoneal hemorrhage, so that blood, it irritates, and when we move the cervix, there is irritation increases, and here it is due to the infection. So when the infected peritoneal cavity and the infected anexa, we move that cervix, that infection irritates more, so there is cervical motion tenderness, and in similar way there is annexal tenderness, and due to that infection, the inflammation caused by infection, there is lower abdominal pain. Okay, so this is a triad. These questions do come on this triad, so please learn this triad by heart. And if one or more of these symptoms are present, then it increase the diagnosis specificity, that the it increase our diagnosis 100 and more specific we are with our diagnosis, that the patient is having the that the patient is having a PID. That is, that if the temperature is increased, if patient is having fever more than 38.5 degrees centigrade, or there is a mucopurulent cervical or vaginal discharge, because cervicitis characteristic discharge is mucopurulent cervical or vaginal discharge. If there is increased ESR, or if the CRP is increased, or there is presence of chlamydia or gonorrhea in the discharge. Okay, so these are the four factors. If these four factors are present, any of one of these four factors are present, it increases our specificity toward our diagnosis on the basis of that clinical triad. Okay, the gold standard is laparoscopy, by which question are coming on this laparoscopic too. So please focus it on the gold standard diagnosis. The chronic PID symptoms, late sequel is quite oftenly asked. The late sequel of chronic PID is infertility due to the salpingitis, interstitial salpingitis. Then it is then there is formation of hydrosalpinx or pyosalpinx or pyometra, or you can say there is abscess, pelvic abscess is also. I have forgot to mention here. You just write down pelvic abscess. Okay, so is also the late sequel. Late sequel of chronic PID is quite often asked. ठीक है, इनफर्टिलिटी हो जाएगी ट्यूब्स में, मतलब लेट सिक्वेल, लेट से लेट क्या होता है, सिम्टम्स क्या आते हैं, इनफर्टिलिटी हो जाती है, हाइड्रोसाल्पिंग्स हो जाता है, पायोसाल्पिंग्स हो जाता है, पायोमेट्रा हो जाता है, और देन देयर इज अ पेल्विक एब्सेस. नाउ द लास्ट स्लाइड ऑन द जेनाइटल टीबी. Okay, the last slide on the genital TB is that genital TB, the mode of spread of it is hematogenous. Secondary focus, primary focus is somewhere else, and then via the blood it comes to the genital tract. The most common organ which gets involved is, that was asked, was fallopian tube. What it do to fallopian tube when there is TB infection? It causes calcification of the tube. The tube has on the HSG appearance of lead pipe or beaded appearance, or there is hydrosalpinx which gives the appearance of tobacco pouch appearance. And if the endometrial cavity is also affected, then there is Asherman syndrome. Okay, in acute tubercular infection there is menorrhagia. Then the patient has hypomenorrhea when Asherman syndrome also occurs, and later on the patient suffers from amenorrhea. Okay, so genital TB is also one of the cause of amenorrhea in the later stages. Okay, so that was all important points about genital TB. See you soon in the next video. So guys, please subscribe my channel to ease my teaching journey. Thank you.